Okay, Bismillahirrahmanirrahim. We were discussing the autonomic nervous system, and then out of autonomic nervous system, we were discussing the sympathetic. I told you, look, this is the spinal cord, cervical segment of the spinal cord, thoracic, and L1, L2, then sacral and coccygeal system. And then on each side of the vertebral column, you can see this chain of ganglion, and this is sympathetic chain or sympathetic trunk, one on each side of the vertebral column, and lower down the two sympathetic trunks unite with one another at this ganglion, which is called as ganglion impar. You can see it over here. Look, these are the vertebral bodies, and over the transverse processes you can see this sympathetic chain. Look, this is ganglion, this is ganglion, and this is ganglion, and this is sympathetic chain present on each side of the vertebral column and the anterior surface of the transverse process of the vertebrae. Okay, then look, the spinal cord is a tubular structure like that, having this anterior surface and this posterior surface. And in the cervical region, when you draw a cross section of the spinal cord, you will see that the gray matter is arranged like that it consists of this anterior horn and this posterior horn. These are anterior horn cells present in it, and these are posterior horn cells present in it. These are sensory in function and these are motor in function. And the fiber which come out from the anterior horn cells, this is called as anterior root, and coming from the posterior horn cell, this is called as posterior root. And this is sensory in function, this is motor in function, and then this nerve comes out. Now this cervical nerve, and in the same way the L3 and 4, L5 and so on, these nerves consist of only two types of fibers, sensory and motor. It do not have any sympathetic fibers. That's why they won't give any branch to the ganglion, because the first branch to the ganglion is being given, that is of sympathetic white rambus communicant. So the cervical nerves would not have white rambus communicant because it does not contain the sympathetic fibers to be given to the ganglion through the white rambus communicant. But the ganglion by itself will give one branch to the spinal nerve, which is the gray rambus communicant. And then the spinal nerve, after receiving the gray rambus communicant, then it consists of three types of fibers: sensory, motor, and sympathetic. But this is true in the cervical region. But in the typical spinal nerve, in the thoracic region, when you draw a cut section, cross section, it is that a group of cells is present in the anterior horn, motor. A group of cells are present in the posterior horn, sensory in function, while a group of cells present in the lateral horn, sympathetic in function, only present in the thoracic 1 to L2 level of the spinal cord. And now the fibers coming from this is sensory. The fiber coming from this, motor, and this from lateral horn, sympathetic. In this way, the thoracic nerves and L1 and L2 nerves will come out of the intervertebral foramen, as you can see over here. Look, these are the vertebrae, and the nerves are coming from this intervertebral foramen. These are nerves, and the sympathetic chain is lying over here. And these are nerves that comes out from the intervertebral foramen, that is the foramen between the two vertebrae. So when this nerve comes out of the intervertebral foramen in the thoracic region, it consists of three types of fibers, that is motor and sensory and sympathetic. What happens? These sympathetic fibers, when come out of the intervertebral foramen, it leaves the nerve and enters into its own ganglion. And this is called as white ramus. It is the first branch of the spinal nerve which is white or myelinated. After relay, these fibers come again into the spinal nerve as gray ramus communicant, which are unmyelinated or less myelinated. And then this sympathetic nerve also consists of the sensory, motor, and postganglionic sympathetic nerves. But the question is that in the cervical ganglion and in the lower lumbar ganglion, when there is no sympathetic fibers in its own segment of the spinal cord, where from they get the preganglionic white fibers. It's like this, okay? Now look, these sympathetic fibers, which come from these cells, some of the sympathetic fiber, all of it leaves the nerve, enter into the ganglion. But some of these fibers relay in the same ganglion, some of that ascend upward into the cervical ganglion, cervical 3 ganglion, superior, middle, inferior, and in this way each ganglion gets the preganglionic fibers from the thoracic segment. In this way, the fibers from T1 to T5 ascend in the sympathetic chain. When it leaves, they reach the own ganglion, but all of them do not relay in its own ganglion. Some of them pass unrelayed to the superior ganglion. And then from the T5 to lower down L2, the fibers, some of the fibers relay in its own ganglion and some pass unrelayed to the lower ganglion, some are relay over here. Then in this way, all the ganglion gets the preganglionic sympathetic fibers, some in the thoracic region from its own nerve, while in the cervical and lower lumbar region from the descending and ascending into the sympathetic chain from the thoracic segment. In this way, all the ganglion ultimately are being connected to the thoracic segment of the spinal cord and to the L1 and L2. And the cervical nerves do not have preganglionic sympathetic fibers. The lower limb also do not have preganglionic sympathetic fibers, but each one must have the postganglionic sympathetic fibers. Each spinal nerve must consist of 3 fibers: sensory, motor, and sympathetic postganglionic. But the preganglionic sympathetic fibers are not present in the cervical and lower lumbar. These are present only in the thoracic and L1 and L2. This is one point which should be clear to you. Now, then when all the ganglion, all the nerves, cervical 8 and thoracic 12 and lumbar 5 and sacral 5 and coccygeal 1, all these nerves have received the postganglionic sympathetic fibers. Now, the sympathetic chain gives how much branches to the different parts of the body. Number 1, each sympathetic ganglion gives branches postganglionic to its own nerve. Because the cervical ganglion are 3 in number, that's why the first cervical ganglion gives branches to the upper 4 cervical nerves, the second one to the middle 2, and the lower one to the lower 2. In this way, all 8 cervical nerves must get the postganglionic fibers. In this way, the thoracic one. In this way, the sacral one. Now, these spinal nerves having 3 types of fibers, then they pass to the different viscera, to the different organs of somatic origin in the body. For example, they go to the skin, they reach to the muscles. Okay, and in the skin, the sympathetic fibers which are running along with the nerve, these sympathetic fibers are, number 1, vasomotor, that is, it constricts the blood vessels of the skin, and number 2, it is sodomotor, that is, it causes the sweat gland which are present in the skin, it causes to increase its secretion. And number 3, pilomotor, that is the hair follicles which are present over here, the smooth muscles over there, the muscles over there, it are being stimulated by the sympathetic. In this way, the hair, which called piloerection, are standing of hairs. So the spinal nerve which reaches to the skin, The sensory component of the spinal nerve has its own function, that is sensation of pain, touch and temperature, while the sympathetic component of the spinal nerve have these functions in the skin: vasomotor, sodomotor and pilomotor. Now in the skeletal muscles, when the spinal nerve reach, the sensory component is having this general sensation of pain, touch and temperature. The motor part of the nerve, it supplies the skeletal muscle fibers for its motor function, while the sympathetic fibers which reach to the skeletal muscle, it has nothing to do to supply the muscle fibers, but it supplies the blood vessels inside the skeletal muscles. And note the point that the sympathetic is vasoconstrictor everywhere, but in the skeletal muscles and in the heart, their coronary vessels, this is vasodilator, that it increases the blood flow to the heart and to the skeletal muscle during exercise condition, which is also called sympathetic activity. Okay, so in this way, sympathetic chain gives one branch to each nerve, and they travel along with the nerves and do the following function which I told to you. Then the second type of branches that are being given by the sympathetic chain, they are being given to the blood vessels, to the nearby blood vessels. And in the cervical region, the three cervical region, especially these superior cervical ganglion and the fibers, the sympathetic fibers originate from the ganglion. They travel along the carotid arteries, these carotid arteries and vertebral arteries. And you know that internal carotid artery enters to the skull, the vertebral arteries enter to the skull. And inside the skull, the sympathetic fibers run around the carotid vessels and they form what is being called as carotid plexus. And then they travel along with the vessels. And especially note the point that these sympathetic fibers, it supplies, number one, the smooth muscles of the pupil, where it is pupillary dilator. It dilates the pupil. And number two, it supplies the smooth muscles of the upper eyelid, that is levator palpebrae superioris muscle. Levator palpebrae superioris muscle of the upper eyelid, and it is because of this reason. Okay, now the fibers which are reaching to this superior cervical ganglion, these are usually the fibers of this T1 level. From this T1 spinal cord, the fibers which comes over here in the sympathetic chain ascend upward into this superior cervical ganglion and then passes, and then it supplies the blood vessels and the smooth muscles of the pupil, the pupil dilator, and the smooth muscle of levator palpebrae superioris. Note the point that if there is any disease at T1 level of the spinal cord, if any disease over here at T1 level, if there is any tumor over here which is compressing over this, then what happens? In addition to other symptoms, one of the symptoms would be at the eyelid, and the patient would come to you that there is drooping of the eyelid. That eyelid, the patient cannot lift the upper eyelid properly or at all. That is drooping of the eyelid, which is actually then called later on myasthenia gravis. That is, the upper eyelid cannot be lifted. Okay, so note this part. If there is patient with myasthenia gravis, you must think one of the cause is this one as well, that lesion at T1 level or tumor that compressing over this nerve. So one branch of the sympathetic chain to its own nerve. Secondly, the vascular branches, they travel to the skull inside. Thirdly, note one point that this is the sympathetic chain, cervical component, this is thoracic component, this is lumbar, this is sacral. Then from this cervical component, So the ganglion of cervical region, the nerve descend down into the thorax. From the cervical ganglion, the sympathetic nerve ganglion enters into the thorax. Also, this is being joined by the upper two thoracic segment, and they enters into the thorax. The branches from the cervical ganglion descend downward to enter into the thorax, and over here these descending sympathetic nerves from the cervical ganglion and the fiber from the upper two thoracic ganglion, they enter into the thorax, and it reaches to the heart and to the lungs. And then these nerves are being joined by branches from the vagus or from the parasympathetic. In this way, one plexus is being formed for the heart and one for the lungs by the combination of the parasympathetic vagus and sympathetic fibers, which we call it as cardiac plexus and the pulmonary plexus. Okay? So in this way, the sympathetic chain, third type branches that will give, it gives the visceral branches, that is the branches to the heart and the branches to the lungs, that is from the cervical ganglion and upper thoracic ganglion. They reach into the thorax, where for the heart and for the lungs it is being joined by branches from the vagus or parasympathetic, and cardiac plexus and pulmonary plexus is being formed. What is the function of these plexuses? At this level, at the first year student, I think I should not make you tense or confused with it. This we will do later on when we go into slides, senior and second year class. Okay. Then other branches in the thoracic region, again this is the sympathetic chain, cervical, and then this is the thoracic segment of the sympathetic chain. This is L1 and L2, and then now what happens from L5 below? Branches are given by the sympathetic chain ganglion for L5 below, which passes through the diaphragm to enter into the abdomen. Okay, into the abdomen, and these fibers, they come to the ganglion, do not relay over here, but pass unrelayed to enter into the abdomen through the diaphragm. And these nerves are called as greater splanchnic nerve, then lesser splanchnic nerve, and least splanchnic nerve. Greater, lesser, and least splanchnic nerves, these are the branches from the sympathetic ganglion of the lower thoracic segment of the sympathetic chain, but these fibers are unrelayed. And over here a ganglion is being present along the celiac artery, which is being called as celiac ganglion. Celiac ganglion. They relay over here in the celiac ganglion, and from this then the postganglionic fibers reached to the nearby viscera, for example, like you can say the stomach and the duodenum, along with the blood vessels, which are the branches of the celiac artery. From the celiac ganglion, these fibers then reach to the concerned viscera by hitchhike along the blood vessels. But they don't relay in the ganglion sympathetic chain, but relay in the celiac ganglion, which is being present in the abdomen. Then some of the branches from the sympathetic chain passes downward unrelayed again, preganglionic, and reach direct to the adrenal gland, which is present over here at the top of the kidney, to the adrenal gland directly over here. They do not relay anywhere, and they relay in the cells of the adrenal medulla. And it is said that the cells in the adrenal medulla act as a ganglion, and they relay over here and then supply the adrenal gland. This is exception to all other parts of sympathetic chain, where the sympathetic fibers reached to the any viscera, and it must have first relayed or synapsed in the ganglion, but the fiber to the adrenal gland, they pass unrelayed. Okay, then other fibers These planktonic fibers, again, I told you, from the sympathetic chain enters into the abdomen, and then the nerves, greater, lesser respiratory nerve, from the lumbar segment also the nerves passes, which is called as lumbar planktonic. They pass over here into the abdomen, and it forms the hypogastric plexus, which is called as superior hypogastric plexus. Then the fiber from this hypogastric plexus passes over down in the pelvic region. So right and left inferior hypogastric plexus is being formed by branches from this sympathetic chain and by parasympathetic. Look, in the celiac plexus over there, the parasympathetic is coming from the vagus, while in the lower part, the parasympathetic is coming from S2, S3 and S4 segment of the spinal cord. And in this way, celiac plexus, superior hypogastric plexus, right and left inferior hypogastric plexus, these are being formed by the combination of the branches of the sympathetic chain and by the branches from the parasympathetic and the upper part from the vagus and the lower part from the sacral segment of the sympathetic chain, parasympathetic. And then from these plexuses, the nearby intestine, urinary bladder, uterus, etc., these are being supplied by polygonal fibers, okay, from these fibers. Okay, then okay, now the branches from these plexuses then reach to the concerned viscera either directly but mostly by hitchhiking along the blood vessels. Okay, this is the description of the efferent component of the sympathetic. The sympathetic also have the efferent component or sensory component. Note the point. The sensory function of the sympathetic or efferent function of sympathetic is number one for automatic reflex. Automatic reflex, that immediately any change in the environment of the internal viscera, for example, if the food reaches to the stomach, immediately it is being ordered to contract. Okay, this is automatic reflex without, and then secondly for pain from the viscera, from the stomach, from the intestine. The pain from the stomach and intestine passes through the efferent component of sympathetic fibers through the spinal nerve, and through the spinal nerve it reaches to the already to the posterior root ganglion, of look, this is the spinal cord, this is the posterior horn, this is the anterior horn. The posterior horn is having overhead, you can see this rounded ganglion, this is posterior root ganglion. Then the fibers travel to the nerve, reach to the posterior root ganglion, and then travel again and then reach to the posterior root. And in the posterior root, when it reaches, then two types of actions are being ordered. Number one, automatic reflex infinitive, and number two, the pain. But the pain which is being transmitted by the efferent sympathetic, note the point, it is not so specific as in the somatic nerve. For example, in the somatic nerve, if someone prick you over here, you can exactly locate this is the prick point without looking even in. But in the abdomen, for example, if there is pain of some viscera, then that will be a vague type. You can't exactly locate, number one. And number two, the efferent fibers, mainly of the sympathetic origin, it note the stretch if any organ is being stretched or distended. And number 2, chemoreception. And number 3, mechanoreception. In this way, the afferent fibers are also being present in this sympathetic chain. They pass backward through the spinal nerve, then reaches to the posterior root ganglion, and then enters into the spinal cord, and then if automatic reflex is being needed, then from the posterior root or to the posterior cell, the connection is being found with the anterior horn to do the concerned function automatically. And then if any thinking is being needed, then the pathway to the higher center is the same as elsewhere for the somatic, that is this impulse is being then transmitted to higher centers for conscious appreciation and to analyze. Okay, this is all about the sympathetic, and I hope you will understand it. Thank you.